back to another episode of the Posted Podcast. I'm your host, Kazzandra, and today I'm joined with Samantha Delgadillo. Hi, Sam.
Hi, Cassie.
How are you?
I'm doing really good today. I'm a little tired, though, but I'm doing good.
Yes. Well, today for International Women's Day, we have our head nurse here on at PSA, Nurse Dora Hinojosa. Hi.
Hi.
She is one of the two nurses on campus dealing with over 2,500 students, which is very admirable. She deeply cares about the students, and today we're going to learn a little bit about her. So we're so excited for that. Welcome on.
Thank you.
So, Nurse Hinojosa, what made you get into the medical career?
I've wanted to be a nurse since I can remember. I wanted to help people. I wanted to be a school nurse from the very, very beginning, but I did start working at the hospital and then transitioned into school nursing, and it's something that I have always loved doing.
That's awesome. That's awesome.
Well, is school nursing all you've ever done? Have you been, you mentioned that you worked at the hospital. So what was your past experience with that? How is it different from being a school nurse and actually working in the hospital?
In the hospital, you have, they're all nurses and doctors. Mm-hmm. So you have that medical support. When you need something, the pharmacy, everything's on hand. And you need to do something, there's doctor's orders, there's all of these things that the doctor can be there for. School nursing is very different. Mm-hmm. So there's a lot, our hands are tied a lot. Mm-hmm. So something that we want to do, we can't do because there's no doctor mm-hmm. here. And then there's no, other than the other nurse, Nurse Elizondo, there's really nobody on campus that helps us with all of the medical stuff, so it lands all on us. So that's the difference between the hospital and in the hospital, you have more critical patients because they are in hospital, for surgeries or medical conditions.
Mm-hmm. Yeah. Well, you mentioned that it's a lot of work. I mean, we're 2,500 students, yes. And it can be a lot for it to handle. So do you wish you had more help or maybe like an extra nurse?
Yeah, an extra nurse would always be helpful because we are busy from the minute that we get here mm-hmm. Till we leave. Like sometimes I don't leave until 5 or 6 in the evening because something comes up after mm-hmm. school, or I have to stay with a student until the parent arrives. So yes, another nurse would always be helpful, especially since we have such a large population. Mm-hmm. But Nurse Elizondo and I work very well together, yes. So we get a lot of our work done. We are the largest school in the district, mm-hmm. and we're the top school that has most of all our requirements, our mandated screenings done.
That's awesome.
Really
That's
good.
awesome. You mentioned how a lot of the medical aspect of the campus falls back on you two. So how important is it for, I guess, the staff and the teachers to work alongside both you and Nurse Elizondo?
Oh, it's very important because we when it comes to like students complaining that they're not feeling well and stuff, mm-hmm. it's nice for the teachers to be able to see like, oh, okay, no, like the student has been sitting down talking, and then all of a sudden they want to go to the mm-hmm. nurse's office, so that kind of helps when teachers are able to observe that mm-hmm. in their classroom and say like, okay, no, go ahead and wait, you were fine, or mm-hmm. until a little later to see how they actually look in class, because mm-hmm.
Observing
somebody, and which that's what we do a lot in our mm-hmm. in our office, is we observe students and mm-hmm. see like, oh, like how sick are they, mm-hmm. So teachers helping out in that area is a great help to kind of reduce the visits in our office.
Yes.
All right. Well, can you explain a little bit of your nurse's station? How do you have it set up? Is there a certain method that you use to be able to help all the students and mm-hmm. even teachers and staff that come in for help?
We have a check-in for our students. So when they walk in, there's a computer, and they put their ID number, the reason they're here, and then they click the check mark. Mm-hmm. So Nurse Elizondo and I are able to, on our computer, view what you put in there. So you don't when you come in, I don't have to ask you like, what are you here for? Mm-hmm. And then you say it in front of everybody, correct?
Yeah.
So when I look at the computer, I can see that, oh, she complained of a headache. So I'll have you, come over here, let me check your temperature, and I'll start caring for you. If I have to check your throat, I'll take you to the cot, close the curtain a little bit so I could check your throat, so not everybody's like staring.
That definitely makes it more comfortable too.
Yes.
That helps out a lot.
So we try and keep it as private as possible, but sometimes we're really a lot of students in there and our cots are taken up. So, I mean, we have no choice but to do it out, in the open. But we do triaging to where, like, if we have like 4 or 5 students come in, we'll open 4 or 5 records and see, okay, like, oh, this one has chest pain, so we need to take priority with that student, check their blood pressure, check their heart to make sure that everything's okay, over what could be like, oh, my eye hurts, or pink eye or whatever. So we do a lot of triaging when we do have a lot of students in our office.
Yeah. Well, what is the importance, I guess, of disinfecting the nurse's office, as well as how often is it done?
Disinfecting is very important because we get everything in there. We get flu, we have COVID, we have, a strep throat. We have a lot of stuff that comes in through our office, open wounds. So we disinfect the beds after every student that lays down on the bed. So you get up, we disinfect it. The counters, we're disinfecting them. We wear gloves. If we have to wear goggles or a face shield, we'll do that as well. We have a hand sanitizer by the computer, so the students can use it before using the computer and use it afterwards if they like. So a lot of them do that. So we try and keep our area very disinfected, sanitized. For many reasons, for your protection and ours as well, because we do see a lot of students and we don't want to be getting sick. So we disinfect it quite often.
Well, the times that I have been into the nurse's office, I do see the, I think it's like a plastic kind of rolling thingy. So that's very smart, so that it keeps, that safety, I guess, from getting infected or anything like that.
Well, speaking of like all the sicknesses that you guys get, what's the most common symptom or illness that students usually come in with?
The main visit is headaches and stomach aches. Those are the main complaints.
Do you think it has like an association with like anything, whether it be food or stress or anything like that?
Probably a little bit of both. Students don't really like to eat. So they'll come in, especially in the middle of the day, complaining of headaches and stomach aches. How did you eat breakfast? No. Did you eat lunch? No. Well, your body needs nutrients to continue throughout the day. And if you don't give your body that, then your body starts to have different type of effects. So headaches and stomach aches is a big part. So sometimes when we have snacks available. So once we give a student a snack, they feel a little better and they're able to go back to class, as long as they don't like vomit or, have to go to the bathroom for other reasons. It's usually a snack or them getting something in their stomach will help them feel better.
Definitely. Well, speaking about the topic of food, being on the topic of food, how healthy is our cafeteria food, and the importance of, I guess, taking that in?
The cafeteria food is actually very healthy. They follow a 1,500 calorie diabetic diet. So the meal is very healthy. There isn't anything fried. The fried chicken is actually baked. The French fries are actually baked. So they do, the pork tamales are made with a different type of masa, so it doesn't have all of that lard and fat in it, which makes it a healthier option for. So it actually is a very good, healthy diet here at school.
What about the pizzas? That's like one of my favorite. That's one of my favorite meals that they serve on campus. So is that a little bit healthier? I'm assuming it is, because it looks a little bit different than the regular, Domino's or Peter Piper pizza.
Yes,
so
it is. Different? It is healthier, and the cheese. It's the cheese that it's a different cheese, so it's not as high in fat.
Cool.
Is it like a vegan cheese, or?
No, I think it's more like a reduced fat.
Okay.
A reduced fat. I think they called it like, I don't know, the government cheese is a little bit lower in fat than the regular cheese, and I think that's the cheese that they use.
Well, it's still super good.
As long as it's good, that's all that matters.
And then the ranches too. I think the ranches are, I don't know, it's like low
It's low.
low
It's from a.
fat.
It's
Low
low fat,
fat,
but
yes.
it's from.
But
it's from a
it's the
popular
good brand.
Yeah,
it's the good brand.
brand.
So
Yeah.
and you can't really taste the difference. So that's a good thing.
That's
But yeah, there are some certain, even for breakfast too. I really enjoy. I think sometimes they give conchas out,
Yes.
and obviously I'm assuming they're healthier
Yes.
than your standard conchas. But those are really good too. So I like how they kind of keep it fun,
Yes.
but also they're able to bring
Make
it
it
back
healthy.
to our health as a priority. What are some medications that you have on standby in case students there's an emergency or students need it?
On a standby, we have doctor's orders. As registered nurses, as nurses for the district, we can't do anything without like a standing order from a doctor. So the standing orders are we can have the EpiPen for
Yes.
allergic reactions. So we have we have 2 on campus. We have the we got the oh wow, Narcan.
Okay.
Narcan is one of the newer medications that we do have now on campus as per this doctor's standing order.
So that's kind of like universal. Sorry, Sam.
No, it's okay.
Is it like kind of universal? So if let's say me, I was having an allergic reaction to something that I wasn't aware I was allergic to, that the EpiPen could be used
Yes.
on me. Okay.
Uh-huh.
Cool.
Yeah.
When you register, during registration, there is actual form that your parents can consent to or not consent to. If they don't want anything given, then they'll put because we have some medications in the nurse's office, like for sore throat. We don't have big medications like Tylenol, ibuprofen, anything like that, but we do have like antibiotic ointment. Like the hydrocortisone for itching, like for rashes, things like that for sore throat, that we need consent from your parent to be able to give it to you. So when you register, there is actual form that says, yes, I give the school consent, or no, I do not. So if your parent doesn't want any medications or anything given at school, then they put no.
Oh, okay.
And you mentioned the Narcan. Is that for also allergic reactions?
No, the
or-
Narcan is for overdose.
Oh, okay.
Okay.
Interesting.
Well, hopefully you
Yes.
never have
You
to
never
use
have
it.
to use that.
to use
Yes.
it. Yes.
But I know, speaking about the EpiPen, before you got here, Mr. Leja was telling me a story about how I believe, I'm not sure whether he needed it or he almost needed the EpiPen, and he was telling us a story about how he took some antibiotics for himself, and that he ate afterwards, and that the food and the antibiotics didn't mix whatsoever. So he got a complete allergic reaction, and he had to run down to the nurse's station, and that you practically saved, well, you saved his life. How was that for you? Because I want to hear your side of the story, because he told me mine. I mean, the poor man was basically dying, but what was like the rush for you, or like how was it?
I'm guessing he gave you consent, right?
Yes. I told him, I was like, I'm gonna mention this.
Okay, because confidentiality is a big thing in the
Yes,
nurse's
yes,
office. So, excuse me. He came down. He was having an allergic reaction. He had swelling and redness, and we gave him some Benadryl.
Yes.
He got better.
I mean, he's standing here today, so I think he was okay.
It was a big reaction he was having, so it wasn't just a minor little reaction that it was. But yeah, we had to give him some Benadryl, and we were just grateful that we didn't have to do the EpiPen.
Yeah. And is it like, I'm sure, well, hopefully not, you've been in many situations like that. What goes through your mind during that time? Is it scary, or have you been through it enough to like be able to be calm and, react accordingly?
I've been able to keep calm. Your adrenaline does start to kick in, but we get so focused on the situation that it's kind of like, okay, what do we have to do? And then how do we react quickly? So kind of like everything gets blocked off around us, and we concentrate on one thing. And since Nurse Elizondo and I work so well together, we're kind of in sync with what we're doing. So she's doing one thing, I'm doing another thing, whether she's checking the blood glucose levels if somebody passed out. She's checking one thing, I'm checking another. And so we work as a team to be able to find out what's wrong with the person that, whether it was a reaction or what, and then it's like, okay, certain medications are held in certain parts of the school, so one of us takes off running to go get it if we need it, or back to our office, and so we kind of stay focused. The adrenaline doesn't really kick in until like after it's all over, and it's kind of like, oh my God, that was like, okay, it was kind of like, oh my God, that was kind of stressful.
Well,
it's
you definitely have to like work good under pressure, right? To be in this occupation. That's me personally. I think I'd be like freaking out. I was just imagining like something in my head, a situation like that, and I was like, no, I
like what would I do?
I would be panicking, and I mean.
Yeah, and when we get called to like, oh, they need a nurse in this room, it kind of starts to like, well, what are we going to go to? What are we going to find? What are we going to? What's wrong? So we start already on our way over there trying to figure out, okay, like what are we going to do?
Yeah.
And in these situations, when do you know it's like the time to like inform the parents or call an ambulance if it were to ever get to that extent?
Well, we check vital signs. We do our assessment, and then depending on what our assessment, what the vital signs, if the vital signs are stable, if the person is alert, wakes up, or if they're unconscious, we make the decision to whether we need an ambulance called or not. So if we're going to make the decision to call an ambulance, well, what we do is we have somebody we have an emergency response team, which is, there's like police officers, security, administrators, the nurses, and our trainers are CPR certified. There's other people on campus that could be part of the group. So if that happens, that group is together so that there's different tasks. So it's like you're in charge of calling the parent. So while we're busy, tending to the patient, somebody else is calling the parent. Somebody else is calling the ambulance. Somebody else is doing different things as a team.
Yeah, and teamwork, you mentioned CPR certification, and then we were earlier talking about working under pressure and stuff. I know, actually yesterday I got CPI certified, and I know that it's a graduation requirement. But hopefully I'll never have to use that in my life, because I don't want to be put in that situation. Because it's scary knowing that, I don't know, whether you can save the person dying in front of you or not. And then, God forbid, I do it the wrong way. It's like you have that person's life in your hands. Pressure, but why do you think it's so important that we have this skill and have this as a graduation requirement? What benefit does it bring to us all? I mean, besides...
to save a life, fast response, fast reaction is the best chance for that person. Okay, so if you check the pulse and there is no pulse, there is no wrong way of doing CPR. As long as you start compressions and you start them early, I'm sure you learned that in the class. Start fast, start early. The person has a greater chance of surviving.
Yeah, because I know you have to do like 100 things per minute. So I was like, okay. Because you have to do it on a dummy, and then there's like a clacking sound, so it's like clack 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 clack, and I was like, okay.
Is it true you can do it to the song?
Yeah.
I have to do. Well, hopefully I won't have to do it, but like if I'm ever in that situation, I should be
as long as you don't do it too slow or too fast.
I know,
just like
because I know like in my CPR they said you have to do it like hard and fast.
Yes,
right?
hard and fast.
Like 2 inches in depth, I believe. So it's like
hard and fast is how they're teaching it, and it's very important because other situations happen outside of the school. Maybe in your own personal life, somebody might collapse and you know what to do. Because it might take a while for the ambulance to get there. So the chances of survival is a lot greater if somebody does know how to do CPR, or even has a little bit of the knowledge of CPR. So that person can survive.
That's good.
COVID was a thing, like 3 years ago? I mean, it still is, but not as prominent. So how has dealing with those types of cases changed since the pandemic and students not being on campus 24/7? How has that changed in the way that you all deal with it?
From the beginning to now?
To now.
Okay, well now there hardly is any cases. Okay, I can say like we have 1, 2, maybe 3 at the most a week. So they stay home for 5 days, and then they can return on the 6th day. We recommend that they continue to wear a mask, but the cases are so much lower than what they were, so it's a lot better now.
That's amazing.
Yeah.
Is it different how you handled things from pre-pandemic to when in the pandemic and then now post-pandemic? Like, how's that? The changes, the differences.
On the visits in the nurse's office.
Well,
or-
more like the way you deal with situations. Like, is it more protective? Do you wear more gear? Do you like different things like that?
Right now, before, yes. When the pandemic first started, it was more gearing up, more coverage and stuff. Now it's more like the flu. Okay, so we do take our precautions, our daily precautions, because we don't want to get it.
Yeah.
Right. So I do wear my mask when I'm checking students. I wear gloves when I'm checking students, even if it's just a sore throat or whatever. I do wear my mask and gloves more often now than I used to before the pandemic.
Yeah, because even when I go to the dentist or the doctor's office, I mean, they always wear gloves, but like pre-pandemic, the mask, like they would never wear the mask to see us or anything like that. We weren't required to wear masks. And then obviously with the pandemic, we had to be very careful with who we interacted. But now post-pandemic, it's like to go to the doctor's office or to go to the dentist, we're required to wear the mask, even though it's like post. But just because things have changed and the precautions have changed with it all. This is, I guess, more of a fun fact, or not fun fact, but something I want to know, but I don't know if you'll be able to answer it just because you mentioned confidentiality.
Yes.
But maybe we can just leave out the name. What's the worst case that you've like dealt with? Whether it be being a school nurse or while you were a school nurse, what's the worst case you've ever had to handle?
I guess there was a situation a few years ago where a student came in and had been to the doctor, and the doctor said, like, there's really nothing much. It's okay. It's like a virus. And the student didn't look well. And we knew the student didn't look well. So we would call parent. Parent would pick him up, take the student to the doctor, and come back. And they said, oh, dehydration, and it's like, no, the student would come in not weak, not looking good. Vital signs were kind of a little unstable. Call the parent back, take him to the doctor, was admitted to the hospital. And it was the frustration of that something was wrong.
Yeah.
And we didn't know what it was. So that I say that was the worst case, because while that student was on campus, we didn't know what would happen because we knew that that student wasn't well, right? So to me, that was one of the worst cases for me, because you just knew that student wasn't well, and there was nothing like you could do or figure out what was wrong.
In the end, were the doctors and you guys able to figure out what was wrong with the student?
Actually, no. They gave him antibiotics that hydrated, and then all of a sudden he just got better.
Oh, okay. Well, that's good.
That's good that he got better in the end.
He got better, but they tried everything. They did everything, so they just didn't know what was wrong. But it was getting weaker and weaker and weaker, and pale and thinner, and it just didn't look well.
That's bad.
Well, at least they got better.
Yeah.
That's a good thing. So I was gonna ask. You mentioned how right now what's more prominent is kind of the flu cases. So what if, for example, you or Nurse Elizondo were to get sick and have to miss for a couple of days? Is there a substitute nurse, or does it just remain to one nurse in the office? How does that work?
Well, there's health aides that are in the district that if one of us is out and there's a health aide available, that health aide can come and help the other nurse. If we were both out at the same time, they would definitely send somebody to cover the school. There's been times, though, in the past where one of us is out and there is nobody to replace that person for the day or whatever. So we try and manage on our own.
Oh, okay. Well,
well, I want to go into like the next topic, because obviously in today's time, mental health is more important than ever. Just because I feel, it's always been important, but I just feel in a sense that people are more open to talking about what's going on, and it's more accepted that there are these problems, and there's mental problems that are happening. So what as a campus are we doing to address this and help the students who struggle with mental health?
Yes, mental health can be an issue for a lot of our students. The counselors, we work closely with the counselors, so, and with the parents, of course. So if a student comes in, we have different things that we assess them, and then we get the counselor involved. The district does have a counselor at central office, but the counselors deal more with those issues. Our counselors deal more with those issues. So once they've been observed and assessed by the counselors, they can do the referrals to the counselor at central office.
And as students, Sam and I, we know how stressful school can be, and how I guess anxiety can kind of attack us to a certain extent. So how can students know if they're dealing with stress and anxiety, and what are some side effects, and what are some solutions to dealing with anxiety?
Anxiety can become overwhelming for somebody who doesn't know what's going on. So a lot of times they'll feel their heart beating really fast, and they start getting a little short of breath. So that's when they come and see us. Okay, so we'll check their pulse rate, we'll check their blood pressure, try to see if they can calm down, to see what the issues are. What happened. A lot of times when you deal with anxiety, you don't know what's going on because you don't recognize what it is until later when, we try to figure out trigger points, like what happened in the class, what was going on. Oh, I was taking a test. And then maybe they didn't study, or maybe the questions, it just becomes overwhelming, so the mind is very powerful, right? Yeah. So it starts to kind of take over and can cause you to feel uneasy.
And how can students deal with that if they're experiencing anything?
Stop. Take a deep breath, kind of try to bring yourself together. Breathing is it is very important because you can hyperventilate. So breathing in through your nose, out through your mouth, counting to 5, breathing in, just kind of bringing your body back to feeling calm again. So that's what we try and do whenever somebody comes in with a little bit of anxiety, a little bit of their pulse racing. It's all about calmness. Breathe in, breathe out. Try and forget whatever was you were thinking about, whether it was all the work you had to do, homework, or assignments, or it could be something as little as we've had the room was so loud, and they started feeling a little anxious and had to be removed from the classroom in order to to feel a little bit better.
Yeah, and you mentioned that counselors usually help and are here for the students, but what can teachers do in the classroom to help solve this issue or help them feel better?
Oh, that's kind of hard for me to answer since I'm not in the classroom. But just recognizing, observing, certain students. As a nurse, you get to know some of the students and what issues they have. I talk to students, and I'll find out he or she worked last night, because they're the income in the family. We do have students like that. So, sometimes they just get a little overwhelmed because they're tired, so getting to know your student, getting to know knowing when not to push so hard, and some of them will come in. I say, you can come during lunch and lie down, take a nap for about 15, 20 minutes, whatever, go eat first and then come back and you can lie down and rest, so just knowing the students and maybe, getting to know them and what their issues are.
Yeah, that definitely helps.
That definitely would help. Sometimes I need a nap, so it's nice knowing that I can just
a little power nap.
Exactly. Another big thing in mental health, aside from anxiety, is depression. And there are a lot of kids who suffer with that. So how can we, detect the signs of depression, and how can we help a person going through that in the most comfortable and easy way?
Depression is It's another hard mental illness. It just being there for that person, being there when they're feeling that way, but mainly they need help. They need to see a psychiatrist, a psychologist, a counselor, somebody to help them go through what they're going through, to see if maybe they can handle it on their own or need medication. If they can't handle it on their own, sometimes they need that extra support from a medical, doctor or psychiatrist or counselor, and some can't do it on their own. But as a friend or as a staff member, just being, there for them, helping them, being supportive.
And when is the right time to, let's say a friend comes to me and starts talking to me about, I've been depressed and things like that. When is the right time to reach out to someone else, for example, a nurse or a doctor or their parents or a counselor, so that they can get the help that they really need?
The minute that they tell you they're feeling depressed.
Okay.
Because that's already an outcry. We call it an outcry when they come in and they say, I'm depressed, or I have anxiety, or I don't want to be here. Like, I don't want to be here. That's already an outcry. They've come to you. They've already told you, I'm depressed. So right when they tell you, then that's the best time to notify a parent.
Okay.
To let their parent know, a counselor know, us know, somebody know that, they have reached out and verbalized it.
Okay.
I think that's important to know because sometimes they'll come to you, but then they'll say, no, don't say anything, don't say, and then, and you don't want to be the bad guy for going and saying
or
something.
Like the snitch or things like that.
Exactly.
Yeah.
And then if they get mad at you for just trying to help them, and that's all you want for them,
Yes.
just for them to be better.
Yeah.
And
Right.
it's tough. It's tough to be in that situation, but
It is tough to be that person to say, like, you can always come to us or to a counselor and let the counselor go, maybe if you want, can you check up on this person for me? They verbalize that they're depressed.
yeah.
A good friend will do that. I know they won't see it like that at first, but once they start to get the help, once they, they know that somebody's there for them, it'll change.
Definitely.
And with all this in mind, I mean, a lot of this it's inevitable sometimes, but a lot of this can possibly be prevented with maybe a healthy lifestyle. And I know I've heard that exercise is a good way to, kind of do this. So what's the importance of having that healthy lifestyle and maybe incorporating exercise into, our routine?
In healthy lifestyle, exercise is very important. It keeps you healthy. I mean, just like eating healthy, exercise gets you going. It keeps your muscles and your bones strong.
Yeah.
So you develop it, and it helps you maintain your weight rather than gaining weight. Once you start gaining weight, your body starts to kind of like wear down. You feel tired. Your bones and your muscles ache. But exercising, I don't know, I say it keeps your joints lubricated.
That's a good one.
Yeah, you're not.
Sam, have your joints been lubricated? Sam has been working out.
I know I have. I mean, I mean, I wouldn't say I enjoy it because I've started going to this trainer. So, I mean, I go twice a week, but that's the most I'll do because I'm so exhausted. I have to wake up like twice a week at 6:30 in the morning to
girl,
go
I
at
can
7.
barely wake up at 7.
I know. I'm like dying and I have to go in at 7 in the morning. But right now I'm like sore from here and I feel like it's tampering with my breathing because I just feel it like in my rib cage and I'm like, it's so tired.
It's hard at first, but
It
once you start a routine, it gets a lot easier. I know I'm getting up at 5:15 to exercise every morning because I don't have time after work.
Yes.
And it took me a while to get into that routine. Now I automatically wake up, right? I'm exhausted by the end of the day, but, it's just that step, once you're there, it's like, okay, it's good.
Yeah, well, I've been going for a few months and I still have not adjusted. I wake up every time I have to go to the gym. I wake up and I'm just like, oh, I guess I'll go.
That was one of my
Yeah.
New Year's resolutions, to wake up early and maybe like go for a run, but something in me just doesn't want to wake up.
I know,
So
it's
I'm not a morning person at all.
No, the only thing I think getting me going is that lately, after like my gym sessions, my dad will let us go get smoothies at Tropical Cafe. So I'm
yeah.
like, I'll go get myself a smoothie. I had the one this morning actually, so it was pretty good. It was very good.
Well, other than eating healthy and exercising, what are some other things that we can incorporate into our lives to live a healthy lifestyle?
Whatever makes you happy. Okay. Some people like to meditate.
Mm-hmm.
You know, some people like to just kind of get a hobby.
Mm-hmm.
You know, all of that is healthy for you because that's something you, rather than sitting down and just watching TV or eating chips or, you know, whatever
Mm-hmm.
while you're watching TV. Being active in life really is one of the main things to do. And, you know, it gets you off the couch.
Mm-hmm. Yes.
And one question that it just came to mind, and I would like to know, during the pandemic, obviously it was a scary time, and especially for our nurses and our doctors, and because you guys are at the front of the line, you're the ones most at risk. Was that scary for you? Did you ever feel like you just you didn't want to go through this profession just because of all the risks that were coming? Because I know a lot of nurses, like, they got burnt out, and it became too much. Did it ever become too much for you?
At times it felt like it did. I never not wanted to be a nurse, but it was very scary. It was very scary because even before the vaccine came out, we were doing COVID tests.
Yeah.
You know, so that was the scariest part, you know, like when I did my first COVID test and actually got a positive and that person was standing right in front of me, it was kind of like, you know, like, that's COVID right there, you know, like,
scary.
yeah, you would hear about it, but you never really knew anybody. And then this person's just like, it's like, okay, take a deep breath. You're fine. You're gloved. You're masked. I mean, we had everything. I had shields and stuff, but that was the scariest part, not being vaccinated and still having to do like COVID tests and stuff like that.
Well, we made it out.
Yeah.
We made it out.
Yes,
That's a
we
good thing.
did.
Yes.
We did.
So lastly, what is so special about working at Bears? It's the most resilient school in Texas. We were honored with that title last year, I believe, or during the pandemic,
during the
actually.
pandemic.
So you obviously played a role in that. What is so special about being here?
It's a family. It really is a Bear family, and everybody just kind of stuck together, and the support, and you know, it's fun working here. I love the staff, and everybody that works here is just, you know, it's a good atmosphere. I love it. The students are great. We've got the best students in the district. So.
Yes, definitely. I would
Yes.
agree.
Go Bears!
Go Bears.
Yes.
Once Bear, always Bear.
Yes, but yes, we definitely have that pride.
Yes.
You hear the word Bears or PSJ or the college high school, and you think of Bears, you know? You
Yeah.
think of us, and I have that sense of pride. I'm sure Sam does.
I do. I very much
And
do.
Yes. So
It's nice
it's a
to
family.
be here.
Yes.
Yeah,
Yes.
it's the first
we
school
love
you
it
think
here.
of.
Yes.
All right. Well, that wraps up our podcast with Miss Nurse Dora Hinojosa. Thank you so much for coming
thank
on with
you.
us.
Thank you so much.
It was nice, you know, getting some healthy lifestyle tips,
Yes.
learning what we can do for friends, and, you know, just learning a little bit about you and your experiences. So thank you so much for coming on.
Thank you for having me.
Yeah, and that's a wrap for today.
Yes. And go Bears.
Go Bears.